Burn injuries are a global health crisis, affecting millions every year. They leave behind a trail of physical and emotional scars. Imagine the searing pain of skin ablaze. Now picture the long-term consequences: disfigurement, disability, and psychological trauma. These unseen wounds often run deeper than the visible ones. Burns are not just a medical problem, they are a societal one. They impact families, communities, and healthcare systems. The financial burden can be crippling, with treatment costs soaring into the millions. The emotional toll is immeasurable, leaving survivors and their loved ones grappling with the invisible scars of trauma. Burn injuries are a stark reminder of our vulnerability. They highlight the fragility of human skin, our first line of defense against the outside world. But beyond the physical damage, burns expose the resilience of the human spirit. The journey of recovery is arduous, but it is a testament to the strength and determination of those who endure. The burden of burn injuries is not evenly distributed. Low and middle-income countries bear the brunt of this global epidemic. Limited access to healthcare, poverty, and unsafe living conditions fuel the fire. These regions often lack specialized burn centers, leaving victims with inadequate care. In contrast, high-income countries have made significant strides in burn care. Advanced medical technologies, specialized burn units, and trained professionals have improved survival rates. However, challenges remain, including the long-term rehabilitation of survivors and the psychological impact of these injuries. This disparity in burn burden reflects global inequalities in health and access to care. It underscores the need for international collaboration and resource allocation. Addressing the root causes of burns in low-resource settings is crucial to reducing the global burden of this preventable injury. Burns arise from various sources, each leaving its unique mark. Flame burns, often from fires, are a common culprit, especially in domestic settings. Scalds caused by hot liquids are prevalent among children and the elderly. Electrical burns, though less frequent, can cause deep tissue damage and long-term complications. Chemical burns, stemming from industrial accidents or household products, pose another threat. Each type of burn requires a specific approach to treatment. Understanding the cause is crucial for effective management and prevention strategies. Beyond the physical agents, underlying factors contribute to burn risk. Poverty, overcrowding, and lack of safety measures in homes and workplaces increase vulnerability. Behavioral factors such as alcohol consumption and unsafe cooking practices also play a role. Burns discriminate by age, targeting different demographics with specific mechanisms. Children, with their boundless curiosity and developing motor skills, are particularly susceptible to scalds from hot liquids and flame burns from playing with fire. Educating children about burn risk is paramount. Working-age adults face occupational hazards. Construction workers, electricians, and firefighters are at increased risk due to the nature of their jobs. Safety regulations and training are essential to protect this workforce. The elderly, often with compromised mobility and sensory perception, are vulnerable to scalds and fire-related burns. Creating safe home environments and providing support for daily activities can mitigate their risk. Section 5, from rescue to recovery, navigating the long road of burn care. Managing burn injuries is a complex and multifaceted endeavor. It demands a multidisciplinary approach with a team of specialists working in unison. The journey begins with immediate care at the scene of the accident, focusing on stabilizing the patient and preventing further injury. Once stabilized, patients are transferred to specialized burn centers. Here the focus shifts to wound care, infection control, pain management, and nutritional support. Skin grafting, a surgical procedure to replace damaged skin, is often necessary for severe burns. Rehabilitation is a crucial aspect of burn care, focusing on restoring mobility, function, and independence. Physical therapy, occupational therapy, and psychological counseling play vital roles in this phase. Section 6. Scars seen and unseen. The lasting impact of burns on survivors. The physical and psychological scars of burns can linger long after the flames subside. Disfigurement, especially on visible areas of the body, can lead to social stigma and emotional distress. Survivors may experience anxiety, depression, and post-traumatic stress disorder. The road to recovery is paved with challenges. It requires immense courage, resilience, and a strong support system. Family, friends, and support groups offer invaluable emotional support. Access to mental health services is crucial for survivors to cope with the psychological impact of burns. Early intervention and ongoing support can help them navigate the emotional turmoil and rebuild their lives. Section 7. Preventing the unthinkable. Strategies for a safer world. Preventing burns is not just a matter of individual responsibility. It requires a collective effort. Public awareness campaigns can educate communities about burn risks and prevention strategies. Simple measures, such as installing smoke detectors, using fire-resistant materials, and practicing safe cooking habits, can go a long way. Legislation plays a crucial role in preventing burns. Enforcing building codes, mandating fire safety standards in workplaces, and regulating the use of hazardous materials can significantly reduce burn incidents. Investing in research is paramount. Developing new treatments, improving burn care protocols, and understanding the psychological impact of burns are essential for better outcomes. Section 8. A call to action. The need for collective effort in burn prevention and care. Burn injuries are a global health challenge that demands a coordinated response. Addressing this issue requires a multi-pronged approach, encompassing prevention, treatment, and rehabilitation. Raising awareness, educating communities, and advocating for policy changes are crucial steps. We must invest in research, improve access to specialized burn care, and support the development of burn centers in low-resource settings. By working together, we can alleviate the suffering caused by burns and create a safer world.